cancer patients often struggle with eating because the mouth becomes too sensitive to handle even simple movements. This sensitivity gets worse during cancer treatment when harsh therapies, radiation, and chemotherapy place extra strain on tissues that are already struggling to heal. When the tissue is inflamed or fragile, every step of eating becomes uncomfortable. Opening the mouth, moving the tongue, letting food touch a sore spot, all of these add to the pain. For many patients, the problem isn't the disease, but the collateral damage caused by therapies used to treat that very disease. The Laser Veda perspective. The Laser Veda preemptive healing protocol, which focuses on ZMP, zero mucositis policy, using photons as a shield. Light itself can create a protective oral barrier before chemo or radiation, akin to a prophylactic light immunity to enhance local tissue response before the onslaught. This enhancement of local immunity through illumination reduces unnecessary tissue disturbance, thus supporting better tolerance. Seeing this pattern over and over made something very clear to me. Patients cope better when we stop adding new irritation to tissue that's already struggling. This understanding slowly shaped the approach I now follow, a gentleness-based method that later became the cornerstone of the laser healing triangle, especially for cancer patients. Its purpose is to reduce avoidable disturbance so that eating becomes a little more easier for people who are already in pain. When we stop adding new stress to sensitive tissues, the mouth settles. Movements feel less sharp, and patients can focus on the act of eating instead of reacting to every small sensation. Indeed, it doesn't change the underlying illness, but it reduces the extra load created by cancer therapies. That's the beauty of the laser healing triangle. It may not add more days to a patient's life, but it can certainly add a little more life to their remaining days. Over time, these three principles have helped patients manage oral side effects of cancer therapy by forming a radiant shield based on judicious use of low-dose biophotonics. Prophylactic light immunity shields against not just physical trauma, but also by boosting the patient's mental state by endorphin and enkephalin release, which are considered as body's natural painkillers. Next, the zero mucositis policy ensures zero infection by judicious use of photodynamic therapy, which comprises of soothing photonic wavelengths used to activate gentle photosensitizers specific for the oral cavity. People tolerate food better when they can set their own pace. Allowing them to decide when to pause or continue makes the experience far less intimidating. When we cannot cure it, we should not at least worsen the condition. Remember, primum non curarum. When these principles are applied consistently, eating becomes less stressful. Portions may stay small at first, but patients begin to participate more willingly. That shift alone improves nutrition, energy, and confidence during treatment. For someone living with cancer, even a small reduction in pain can change the way they face a meal. Even a small increase in meal consumption can improve their nutrition, thus making them that much more stronger to fight the disease as well as the side effects of its therapy. If you're dealing with any of these mentioned side effects during treatment and want my guidance, feel free to book a consult with me at www.laserveda.org. If you are a dentist, a doctor, or an oncology caregiver and wish to integrate these strategies into your routine care, you may join the Asian Academy of Laser Therapy as a member. AALT members get access to the Laser Pro app, which includes complete mucositis protocols, an e-library, a knowledge base, and weekly live teaching sessions conducted every Friday under the banner Photon Fridays. Members can log in from any location and attend real-time sessions with faculty from India and abroad. These global resources are available exclusively to AALT members.